In this video, we'll review iConnect Access. I'll log in with my user ID and password. And the first thing I see is my study list. You'll see that under Studies, we can do a custom search, which gives us all of these different fields that we can search by. Or we can look at saved searches, and these saved searches are just ones that this user has saved. So first off, we'll look at all the studies performed in the last 12 months in CT. And I'll click Search. And I get my patient results list. Now I can save this search and name it what I like. I'll call it CT's one year and save. Now I can also say last 2 years. I could save that search. I don't have to run the search to save the criteria. And this will be CT's 2 years and save. And now we'll see those under our saved searches. You can see you can search by the patient's last name and first name, the patient ID, the study ID, the accession number, an institution, when the study was performed, and you have certain date ranges, or you can make your own custom date range. So you can choose any day to any day and just say OK, and that'll make your own date range. And the data sources are actually what storage you're looking at. So if you have images stored on more than one data source, you can look at either or all of them. You'll see under referring physician, you can actually enter a referring physician's name. This has to match the DICOM header exactly to produce results. You can also search for my patients only, and that would look at my username, again, matching on the DICOM header exactly and produce only my patients. So this is good for referring physicians, but you have to make sure that the referring physician name is exactly what's in the DICOM header. I'll click on the Saved Searches radio button, and you'll see in our drop-down, we have both of those searches that I saved. So I'll say 1 year and click Search. And you'll see that it produces the results for that criteria. You can run saved searches against different data sources if you have different data sources. You can also delete a saved search. When we look at our list of patients, we'll see that right now they're in study, date, and time order, and you can see that by the arrow next to the header. You can sort any of these columns. I can sort by last name, click it again, and it puts them in reverse order. To view one of these studies, we would either double-click on the line of the study, or we would click one time and click View Study.